out on my estimate, and we'll be right with you. Thank you for
Okay,
your
gentlemen, why
patience.
don't you
We
take
really,
one?
really
We'll
appreciate
and
it.
social distance accordingly. Folks, we're ready to go at your end? Okay. Well, good morning, everyone. Please allow me first to introduce myself. I'm Nando Yanika, the chair for the Region of Peel and also the chair of the Region of Peel Board of Health. Let me begin this week of Remembrance Day, if I may, by honoring our veterans for the sacrifice they've made so that we can enjoy our cherished freedoms. And that gratitude really extends to our Peel staff and our frontline healthcare workers and their tremendous efforts to deal with this virus at great personal sacrifice to family and friends as well. Today I'm gathered here with my colleagues Dr. Lawrence Lowe and Dr. Naveed Mohammed because the COVID-19 virus continues to grow in our community of Peel, and we must take unprecedented actions to keep our community safe, and it is fair to say keep ourselves and our families and neighbors alive. Brampton, Caledon, and Mississauga are the places we call home, home to over 1.5 million residents and 175,000 businesses. COVID is significantly threatening our lives, livelihoods, and our healthcare system. That's why I've brought together Dr. Lowe, our Medical Officer of Health, and Dr. Mohammed from William Osler Health System to share and clarify the most recent directives and call for action in the community to keep each other safe. You will hear in a moment from our hospital partners, and then I will ask Dr. Lowe to speak to the measures now in effect in Peel. I know the mayors of Mississauga, Brampton, and Caledon, and all of our members of council are in support of our medical officer of health and the very hard decisions he and the public health team must make based on the evidence before us. Never before have I heard such concern from our hospital partners with unprecedented case numbers in the community and coming through their doors. And at the same time, we hear from the community, church, and Father, worship leaders, places of religious assembly. Are these measures really necessary? They are. I am worried for each and every one of us. This is a very serious situation. We have the highest test positivity rate in the province. The highest test positivity rate in all of Ontario. Let me repeat that one more time. We have never reached the unprecedented numbers that we are at relative to the rest of our province. So let me introduce first Dr. Naveed Mohammed from William Osler Health System for a situational update for our Brampton hospitals. Dr. Mohammed.
Good morning, everyone. I'm Dr. Naveed Mohammed, and I am the President and CEO of William Osler Health System. In recent days, Osler has faced new challenges as a result of COVID-19. As the number of COVID-19 cases in the community continue to rise, we have seen a corresponding increase in the number of patients who are seeking care at our hospitals. This sharp increase has resulted in Osler experiencing significant capacity pressures. These pressures are compounded by the flu season and an ongoing outbreak at our Etobicoke General Hospital site. To ensure our patients continue to receive safe, high-quality care, and as an interim measure, we made the proactive decision to partner with other GTA hospitals to care for some Osler patients. On November 6th, Osler began to transfer some patients from our Brampton Civic Hospital and Etobicoke General Hospital to our partner hospitals. These transfers are helping to ensure Osler has the necessary capacity to provide care for patients in our emergency departments and admit new patients to our units. Our top priority is to deliver safe, high-quality care to all patients, and this interim measure is necessary to ensure we are able to continue to serve the healthcare needs of our community. Our teams continued working with patients and families over the weekend to appropriately identify and transfer patients. We expect these types of transfers to continue over the next few days. To date, over 20 patients have been transferred to other hospitals. We are working with the Ministry of Health, Ontario Health, and partner hospitals to ensure safe transfers and seamless continuation of care for our patients. To ensure sufficient capacity, we've also postponed some elective surgeries. Now, these are non-urgent surgeries. Patients are being notified directly if their surgery is being postponed, and we will reschedule these as soon as we're able to safely do so. Currently, there are 55 COVID-19 patients at our 2 hospitals, and 9 of these patients are receiving care in our intensive care unit. We're closely monitoring our patient volumes and continue to work with Dr. Lowe and our colleagues in public health to ensure we have the latest information with regard to COVID-19 positivity rates in our community. The restrictions that were mandated by the Region of Peel are critical to helping reduce the spread of COVID-19. Following these directives will help to ensure that fewer people acquire the virus, fewer people become ill and require hospitalization. The health and safety of this community and our patients is our highest priority. With case counts and positivity rates being at an all-time high and our hospitals at capacity, William Osler Health System supports these measures. We will continue working with Dr. Lowe and his team to support this very important work. Thank you. I'm going to now hand over to my colleague, Dr. Lawrence Lowe.
Thank you, Dr. Mohammed. Thank you, Chair Yanika. I want to start by thank you, Chair Yanika, our local mayors, our regional council, for all of the supports that have come in attempting to implement these additional measures. These have not been easy decisions that we have taken during a difficult time, but the leadership and support of our regional council and mayors and chair on these measures will help keep Peel residents healthy and safe as our pandemic picture continues to grow more concerning. I also want to thank the province for their support in producing a framework that we can build on locally to address what we are seeing in our community. It meant that as we moved to the red control stage this past Saturday, we were able to identify additional measures to target key drivers of COVID-19 transmission within our community. I've been grateful for the leadership of Dr. David Williams and his team and all the conversations we've had with the ministry in working together to address what we see in Peel. Finally, I want to recognize our hospital and healthcare partners and everyone in our community. I know this year has been difficult, and everyone has sacrificed so much in order to save lives, protect our healthcare community, and also minimize the impacts of disease here in Peel. I want you to know that my team at Peel Public Health and I do not make these directions and recommendations lightly. Of course, we would much rather keep much of our community open with precautions. I understand that broader long-term health and well-being are considerations that come with closures. However, at a certain point of pandemic growth, it's crucial to take decisive steps to bring the threat of COVID-19 back under control so that we can remain open with confidence. At this point, the picture that we are seeing in Peel is increasingly dire. Our cases are continuing to rise, and the contact tracing capacity that we developed and improved throughout the summer is increasingly challenged as this second wave continues. We are starting to see not only our local hospitals at risk of being overwhelmed as they navigate this surge of COVID-19 patients, but also the regular volume of care as they start the flu season. Peel Public Health is receiving contact tracing support from across the province, and our hospitals are transferring patients all over Ontario. That means that our public health and healthcare system in Peel is at capacity, beyond capacity. That means we must take additional action to get COVID-19 under control in Peel. I will now walk through the additional measures that have been implemented. I know that these will impact you and your loved ones. In proposing them, however, our priorities are to ensure that our hospitals can cope, that we can keep COVID-19 out of our long-term care homes, and keep our schools safe and open. This means we need to stop spread in our communities and bring our case numbers and hospitalizations down. We've done it before, and I'm confident that we can do it again. I also want to be clear that except for the instruction on wedding receptions, all of these measures are intended to be revisited on a regular basis every 2 weeks. We are not canceling December holidays at this point in time. Our data, after 15,000 case and contact tracing investigations and thousands of exposure assessments, are targeted at some of the major drivers of transmission in our community. So firstly, wedding receptions and gatherings in business establishments are not allowed effective Friday, November 13th through till at least January 7th, 2021. We have put this date in place, January 7th, in recognizing that there needs to be plans around postponing large wedding gatherings. This date may be extended depending on what our pandemic picture looks like in January. But please, the message is clear. No wedding receptions through the end of the year. And please don't attend any outside of the region as well. We have seen dozens of wedding exposures and outbreaks that have driven our case counts, including one wedding in York Region, which saw 33 of our residents infected. Secondly, social gatherings celebrating holidays and life events, excluding the wedding reception and gatherings, in business establishments are not allowed, starting from Friday, November 13th, until its next reassessment in 14 days. Large gatherings for holidays, birthdays, engagements, retirements, or gift showers have also been another source of spread, and notably over our Thanksgiving surge that pushed us into our second wave. We will be issuing further guidance for workplaces, but at this time I instruct workplaces to allow employees to work from home as much as possible and do not permit non-essential visitors on your sites. For gyms and fitness centers, Peel Public Health continues to discourage group instruction. If you do proceed with group classes or instruction, please require participants to pre-register, do not permit walk-ins, and keep your class attendance lists for at least a month in case they are needed for contact tracing. For rented meeting and event spaces, including banquet halls, we ask that no events be held except in an emergency capacity under government direction, and that only staff be permitted on site for the purposes of preparing and providing food for off-site consumption. In addition to these instructions, I also provide the following strong recommendations for Peel. While we cannot force you to take these additional steps that I'm about to outline, I know you will do what is right for you, your family, and your community to prevent us from moving further up the provincial framework into the lockdown stage. I ask that you limit contact to members of your immediate household and essential supports only. Those that live alone may join one designated home and stay exclusive to that home. If anyone becomes sick, please isolate away from all the people in that home. I ask that you avoid visiting other people's homes, with some exceptions for emergencies, renovations, or on-site learning that should always occur with precautions. Beyond your household, I ask that you limit all in-person activities to essential activities only. This includes work, school, exercise and fitness, access to healthcare, and the purchase of necessities such as food or drink, gasoline, and automobile maintenance. For everything else in person that is not essential, socializing, celebrating, etc., I ask that over the next 14 days, until we reassess our situation again, please cancel, postpone, or hold these meetings virtually, and as much as possible, only engage in activities with your household and essential supports. For premises that serve food and drinks, to the extent that you can, we recommend seating groups to members of the immediate household and essential supports and separating those groups by 2 meters. For leaders of places of worship, while I cannot instruct this, I strongly recommend considering religious services, rites, and ceremonies virtually or by live stream as much as possible. And if they must be held in person, I strongly encourage that you consider an upper limit of 50 people total on top of the province's 30% capacity limit, and ask that only immediate households and essential supports be sat together with 2 meters between groups. These measures are what we need in Peel now to stop the spread of COVID-19 in the community and to prevent further hospitalizations from overwhelming our hospitals. And I want to be clear, I am all for a balanced approach to responding to this pandemic, but when our case levels get this high, the balance tips towards addressing COVID-19, lest it grow out of control and start to make our decisions for us. So over the next 2 to 4 weeks, please stick to these restrictions within Peel and if you do travel outside of our community for an essential purpose. By reducing our in-person contacts, we will reduce transmission and take control back from the virus. Reducing case levels will protect lives, our healthcare system, and allow us to return to a reopening with broad adaptations. We've come together before to flatten the curve and slow the spread, and I'm confident that Peel will do it again. Thank you, and I'll pass it back to Chair Yanika.
Well, Dr. Lowe, Dr. Mohammed, thank you very much. You've heard from the experts, you've heard the facts, you've heard the science, you've heard the state of affairs. We must all pull together now to bring down these numbers because, as you've learned, our lives depend on it. The restrictions set forth in emergency order set forth by myself and Dr. Lowe are to be necessary at this time. Finally, before we take questions, I do want to give a shout out to, from the Premier on down. You know, we respect the situation the Premier's in. He's given us great guidance along with Dr. Williams. It's an unwinnable position, but on a personal level, I do want to thank Premier Ford. You know, it was about 5 or 6 weeks ago, he called us here at Peel, said, I want to convene a meeting right away, and we did so virtually. And when the meeting was done with all of us, you could tell the Premier just wanted to look in on us and see that we were doing okay, recognizing the gravity of the situation and how they could help. So to Premier Ford, thank you for what you've done. I also want to extend that gratitude to our local MPPs, all of whom are in contact with us regularly, wanting to make sure that we're taking the best steps going forward. A very, very, very special shout out to Mayor Crombie, to Mayor Brown, and to Mayor Thompson. You wouldn't be aware, but I asked staff this morning with regards to the meeting that I host virtually every day at 5 o'clock. We call it our COVID-19 meeting. Since I had to issue the emergency order on March 13th, we have had 120 meetings, including about 7 since Friday, discussing this issue with all of the experts that you see, with all of the medical staff giving us the best science and information so that we make the right decisions going forward. So with that, I hope we've expressed the gravity of the situation. I hope you take to heart the advice that our medical experts are giving us. And with that now, I'm happy to turn it over to any questions we may have.
Two questions. I'm going to call on you from my list. I will call on any other members of the media at the end who may have joined the call in progress. Please remember to use *6 to unmute yourself, and after your questions are finished, please put yourself back on mute so that others may proceed. We're going to start first with Radio-Canada, Julie-Anne Lamoureux.
Julianne, bienvenue. Do we have our friend from Radio-Canada? If not, perhaps we can come back.
So CBC, Linda Ward.
Linda, if you're on the line, please go ahead.
Hi there. Can you hear me?
Yes, I think we can. Go ahead, Linda.
Hi there. Can you hear me?
Yes, we can, Linda. Go ahead. Who is your question directed to?
Hi. Thank you for taking my question. I'm just wondering if you can outline just how these new measures will play into things like registered activities, organized sports, things like that for children.
Very good. Dr. Lowe?
Yeah, thank you very much for the question. As we outlined, an essential reason for an in-person interaction would include exercise and fitness, and so certainly for organized sports, provided that they are conducted within the framework that the province has set out and their relevant guidance, those could continue. Thank you for the question.
Is there a follow-up? If not, back to our next question.
Thank you. And just as a bit of a follow-up, I'm interested in the testing and how this may have played into the levels that we're seeing in the spike in Peel. How much do you think the limiting testing to an appointment-only model affected the spike in Peel?
I think both doctors might like to speak to that. Perhaps Dr. Mohammed first, then Dr. Lowe.
Thank you for your question. Even though a couple of weeks ago the province did change our testing to appointment only, we continue to test a large number of people at our organization. We're testing anywhere between 1,400 to 1,700 patients a day. So our testing numbers have not decreased significantly. We still continue to do the highest number of tests of any organization in Ontario. So even though there was a temporary drop in testing when we were setting up our appointment system and informing the community, I don't believe the testing numbers have had an impact because our numbers continue to be at a very high rate.
Thank you. Dr. Lowe says that suffices. Back to our list of questioners, please.
I'll call on Shauna Hunt from City News.
Shauna, welcome. What's your question? Shauna Hunt, can you hear me? Please proceed with your question. Staff, perhaps we'll try to move on. And
Megan Ogilvy from the Toronto Star.
Megan, if you can hear me, please proceed with your question. Clearly, we're having a bit of a technical challenge.
If I could remind people who are on the line, star
Yes,
6.
hi there.
to get you
Can you
off
hear me?
mute.
Go, and who is this, please?
Hello?
Yes, I can hear you. Who is it, please? Please proceed with your question, but just so we're clear, just identify yourself and proceed with your question.
This is Megan Ogilvy from the Toronto Star.
Very good. What is your question, Megan?
Yes, there seems to be a delay, so when I speak, it's about 20 seconds after that you hear it.
Okay, but we can hear you now. Why don't you try and proceed, and even if we have to delay somewhat, why don't you give it a go, Megan?
Perhaps we'll try to move on. Megan, if you can hear me, please proceed with your question.
Can you please explain to me the data or the on-the-ground experiences you're seeing in Peel that would make the case for needing an isolation facility for Peel, the same way that Toronto has?
Dr. Lowe.
Yeah, thanks very much for the question, Megan. In general, household contacts remain one of our most significant drivers of transmission. I did not speak to this in detail in my remarks, but both workplaces as well as household transmission are also areas that we will be targeting in the days and weeks to come, recognizing that those also continue to drive things forward. I believe in our recent most weekly epidemiologic update that household contacts were over 50%, and I would encourage you to double check that number online. It's certainly there. And that really speaks to once COVID-19 is introduced into some of our households, the situation in Peel is we have many households with we have lots of occupants, and so there are a lot more occupants in our households than in typical places. For example, if you think about downtown Toronto or downtown Ottawa, and so certainly that speaks to the need to have a safe place for people who either have COVID-19 or who have been exposed to it at high risk to have a place to isolate if they're unable to safely isolate at home. Thank you for the question.
The conference has been muted.
Okay, through to staff, our next questioner.
Exposed to it at high risk to have a place to isolate if they're unable to safely isolate.
And I apologize again for any technical difficulties. Staff, do you have any guidance that I might provide that might be helpful?
Through to staff, our next questioner.
Sir, it seems as though we have a slight delay between the telephone system and the questions, so we'll just pause and wait for 10 to 15 seconds to allow the individuals to ask their questions. Next up is the Toronto Star Queen's Park, Snay Dougal.
Very good. Queen's Park, Toronto Star, you're up, and we will wait for the delay.
Please remember to use *6 to unmute yourself and try to go ahead. Laura Stone, Globe and Mail. Apologies for the delays. Let's try Nita Zafar at the pointer. Nita?
Hi there, can you hear me?
Yes, please identify yourself and give us your question, please.
Hello, can you hear me?
Yes, I can. Please identify yourself and your question, please.
Identify yourself and give us your question.
I apologize, there is a delay. My name is Nida Zafar. I'm from The Pointer. So both of my questions are for Dr. Lowe. In the instructions introduced over the weekend, there's a difference of what is and isn't allowed between restaurants and banquet halls. Why is that? Why can't we just put the strict restrictions in place for restaurants right now, as you have for banquet halls, especially since we know there have been outbreaks in restaurants?
So thank you, Nida, for the question. At this time, I'm sorry,
The conference has been muted.
I'm hearing a bit of echo and feedback. So I'll start answering the question again, Nida. Thank you very much for the question. So there is a recognition at the request of banquet hall owners that they wish to remain closed. Just at the numbers that they're permitted to open, it's apparently not viable. In addition, we do know that banquet halls especially host a lot of the large gatherings that have been described. In respect of your piece around restaurants, we are asking people, if they are going to be dining out, that they ensure that they are dining only with people in their immediate family, and that is meant to reduce risk in those settings as well. But the reality, Nida, is I would focus less on settings at this point in time and really focus on really trying to limit as much as possible your in-person interactions outside of your household. So whatever settings are open or closed, that's actually a bit of a moot point at this point in time. The regulations are targeting some of the highest risk ones that we've identified, but we're asking everyone in Peel, close contact only with your immediate household and essential supports, and outside of that, limit it to in-person for the most essential reasons with precautions. Thank you very much for the question.
To staff, next question. And again, our apologies and thanks for your patience. It seems to be working, notwithstanding a 10 to 12-second delay, but
And
we're
if I
working.
can please get a follow-up,
Please.
Dr. Lowe, how are you going to ensure all these rules?
Seems to be working, notwithstanding a 10 to 12-second delay.
And if I can get a follow-up, Dr. Lowe, how are you going to ensure all these rules and instructions are enforced? I, again, apologize for the delay.
Yeah, no worries. Thank you, Nida. Certainly, we do recognize that there are lots of instructions and regulations. At this point in time, the focus is really on educating the public around the grave situation that we are in. And certainly for the instructions part of the letter, we will aim to enforce those as we can on a complaint basis going forward. But really the focus right now is not on enforcement. We're really just trying to tell people at this point in time, we are seeing and we are quite concerned not only about the level of cases and transmission that we're seeing in our community, but the fact that we are seeing one of our hospital systems really having challenges with capacity, which does not bode well if there continues to be a COVID surge on top of usual healthcare needs that might need to be served there. So, I think it's a matter of getting the word out to the community. Just like speed limits, most people will actually adhere to it and stick to around the speed limits, and our goal will be to catch the most egregious, including the large gatherings that we have identified in the instruction. Thank you.
I will call on Sean Jeffords of the Canadian Press.
Sean from the Canadian Press.
I'll call on CP24.
CP24.
Steve Cornwell from Metroland.
Our friends from Metroland Publishing.
I have a number of questions that have been sent in. For those individuals on the line, if you are struggling with the questions in the phone line, please send them to the contact that you were provided earlier. I'm going to start with questions from Julianne Lemeroux from Radio Canada. Dr. Lowe? If you could please explain in French the gravity of the situation in Peel with the hospitals being over capacity. Are you worried? Have you lost control?
Merci beaucoup pour la question, Julie. Je pense que non, mais nous avons clairement l'une des pires explosions de COVID-19 dans le pays et pour cette raison, j'ai proposé des mesures supplémentaires pour ajouter le cadre provincial qui a été annoncé la semaine dernière. À Peel, nous devons réduire nos interactions en personne à l'extérieur de la maison aux seules raisons essentielles pour le travail, l'école, soins de santé, exercice et l'achat des produits essentiels. Lorsque nous devons faire un rendez-vous à l'extérieur de la maison, je vous conseille de respecter toutes les précautions lorsque nous nous réunissons pour des réunions essentielles, notamment la distanciation, le port de masque et aussi de s'isoler si si vous êtes malade. Merci beaucoup pour la question.
I have a follow-up, Dr. Lowe.
Yep.
The fact that Peel went ahead and added restrictions, does that mean that the restrictions from the province are not adequate for the gravity of the situation? And please respond in French. Thank you.
Oui, merci. Ici, nous savons que le cadre provincial nouveau présentait une opportunité d'augmenter nos mesures ici dans la région de Peel. Et nous sommes en travail avec notre partenaire à la province de protéger la santé de régions ici à Peel. Mais c'est très important dans ce moment de réduire nos interactions en personne à l'extérieur de la maison et aussi aux seules raisons pour les raisons essentielles comme mon autre réponse. Merci beaucoup pour la question.
Thank you, Dr. Lowe. If you could stay at the podium. This question is from Laura Stone of the Globe and Mail. Can you explain why you felt the need to impose your own restrictions on Peel? And should other regions that have concerns follow suit?
Well, I think I would first start by saying that these are not my own restrictions. They are certainly restrictions that are developed by Peel Public Health on the basis of the data and evidence that we have in respect of the situation and the growing pandemic that we have in our community. I think we had made very clear that when the province's new framework was announced, that some of the measures that were provided in there would require us to provide additional measures to counterbalance the growth in interactions that would be anticipated from some of the reopening that was anticipated to occur. Once the province, working with us, moved us into the red control category in view of our worsening situation in our hospitals, that was where we decided to continue forward with those measures, especially given the deteriorating picture in both our public health contact tracing as well as our healthcare capacity, to really target some of the significant drivers of transmission that we are seeing in our community. And so it's for that reason we decided to build on the provincial framework, and certainly I've had many conversations with Dr. Williams and his team there is a recognition that we are uniquely positioned in the province of Ontario, not in a good way, in the region of Peel, with our significant case and incidence rate, our test positivity, and significant capacity challenges with both our ongoing contact tracing and our hospitalization. So these measures are designed to try to bring this under control, to keep our residents safe, and ultimately to keep our vulnerable settings such as long-term care, schools, and our hospitals functioning and operational. Thank you very much for the question.
There is a follow-up.
Yeah.
Can you explain why you're going so far as to ask people not even to visit outside with other households? Can't this be done safely, and isn't it an extreme measure?
Well, I don't think it's extreme, and it's certainly not the only time that this has been suggested. I think Dr. Bonnie Henry in British Columbia has instructed the same for Vancouver Coastal and Fraser Health Authority. I think Quebec has had this in place for quite some time, that nobody from a different address should be at someone else's address. We recognize that there are reasons, exceptions for all these other persons, to meet other persons, but certainly indoors and home we know is very risky, even if measures are being taken. Outdoors, we see people in 3D instead of on a Zoom call, and we have a tendency to draw closer. That's just human nature. So I think it's a matter, especially just temporarily for the next 2 to 4 weeks, if we can really limit the amount of household mixing that's going on between households. Hopefully we can have these current chains of transmission burn out, and be able to see our cases drop to a point where we can support, a safer reopening that is not necessarily going to overwhelm our hospital and healthcare system, get into our long-term care homes, and possibly shut down our schools. So thank you very much for the question.
Thank you. This question is from Patty Winsa of the Toronto Star. What is the penalty for not adhering to the instructions, particularly for households?
Dr. Lowe?
So thank you, Patty, for the question. In respect of households, like I said, this is a strong recommendation at this point in time. It is not an instruction that is being directed, and it's certainly not one that we would find to be enforced. But we really need to encourage everybody, just as our cases continue to grow, as our hospital picture becomes more and more dire. We just need people to really do their part, take this at least seriously over the next 2 to 4 weeks, so that we don't have to take, or so that the province doesn't move us into a further stage in their category. So there's no penalties, but we are really encouraging people to do their part and limit their close contact to their essential households and immediate supports as much as possible. And then for everything else in person, to really stick to just the most essential reasons. We all have a minimum number of in-person interactions that we have to engage in by virtue of our work or school or what have you. Keep it to that minimum as much as possible. Avoid the little social get-togethers and gatherings just for the next 2 to 4 weeks, and do them virtually if you can, so that we can try to get this under control and again reopen with confidence. Thank you for the question.
There's a follow-up. The province announced new assessment centers and more testing. How will this help?
Certainly, I think, in general with testing, as you know, it's about really trying to make sure, and one of the things that I've not said necessarily, but is very vitally important, if you are experiencing symptoms that are consistent with COVID-19, we absolutely encourage you to get tested. It's absolutely vital, both for contact tracing, both for your own purposes, in the event that you need to seek treatment. So if you are sick with symptoms, the typical symptoms of COVID, I won't list them all here, but please go and get a test. And I think more testing will allow us to identify where spread is occurring, where there's additional areas of transmission that we may need to address. So I think testing continues to be an important weapon in this, but ultimately the biggest thing we all need to do at this point in time is really limit the number of in-person interactions that we're having outside the household. Thanks for the question.
This question
And if I could, I just wanted to go back. I wanted to speak on behalf of the mayors and the team here. The question about enforcement was asked. It was discussed at some length over the weekend as well with the team that we have put together. Dr. Lowe has spoken to it, but I really want to deliver this message on behalf of the mayors. They didn't think, and I certainly didn't want to follow through with the stick right now. It's still time for the carrot because, as the mayors made very, very clear, we want to say thank you to the 95, 97, 99% of the people who are adhering to our directives, to our guidelines. You've done a very, very good job. We commend you. You heard Dr. Lowe say that as well. And the mayors expressed that in earnest. Bonnie and Patrick and Alan wanted to reward and say thank you to the good folks in Mississauga, Brampton, and Caledon that are fighting the good fight with us. We want to keep working with you together, and that is why we are holding back on a regime of strict enforcement, waiting to see and hoping quite certainly that in the next 10 to 14 days, you'll carry on just as you have, as you've made all of us proud, and something certainly that we can revisit in the days to come if the situation should change. Thank you. Next question.
This question is from Sean Jeffords of the Canadian Press for Dr. Mohammed.
Dr. Mohammed?
I'm wondering if hospitals in the region are canceling surgeries as a result of the capacity issues they're experiencing, and what is being done to manage these serious capacity issues.
So the first thing is that we are only canceling what we call elective non-urgent surgeries. These are surgeries that will not impact survival rates or complications. Surgeries that involve cancer care, surgeries that come in through the emergency department that require emergency surgery continue to happen. The ones that we're canceling, we will be able to reschedule them once our capacity issues resolve. As I told you, not only are we working with all of our partners in the GTA to manage these volumes, we have also made sure that every available bed that can be staffed within the hospital has been opened so that we can put patients in every place we have available. What you must understand is that there are two limiting factors during a pandemic like this. One is staffing, because a number of our staff may be off because they may have symptoms of the flu, they may be waiting test results. And secondly, when we admit a COVID patient, that one COVID patient goes into one room. Now that room may have 3 or 4 beds or be able to usually accommodate more than one patient, but because this person is isolated, they go into one room. So at our organization right now, there are more than 100 patients that are either confirmed COVID positive or awaiting their results, each occupying a single room. And this becomes a much more inefficient process as compared to what we would usually do. So we're doing everything we possibly can. We have every nook and cranny open and staffed that can safely house a patient. But the isolation issue, the staffing issue, and the sheer numbers with flu, with COVID, and everything else that we're handling is what has resulted with the current situation.
Follow-up for Dr. Mohammed. What is being done to manage these capacity issues?
I think I already answered this, is that we've got every possible area in the hospital open. We're trying to maximize our staffing. We're using our own nurses, we're using agency nurses, but the isolation issue really causes an inefficiency in our patient flow process.
Thank you. This question is also for Dr. Mohammed.
I'm just going to, before that, Dr. Mohammed, I wanted to follow up because, again, it's been a topic of discussion, and I want to single out Dr. Mohammed and Michelle D'Emmanuel from Trillium, because this is the piece that gets lost in it, and I'm so glad that Dr. Mohammed is speaking to it. We all hear this, and we all worry about it and try to understand it on a familial level, loved ones, how will this affect me? I hope you're making an account of how this affects our healthcare workers. Dr. Mohammed and Michelle D'Emmanuel from Trillium have told us the incredible pressures this is putting on our healthcare workers. Many of them have been inflicted with this. Many of them have had to work the double and the triple shifts. Many of them are working in a limited environment because they're at capacity and bursting at the seams. So when you wear one of these things and when you follow this guidance, remember, amongst the people that is hardest hit by this are our healthcare workers, and that impacts the back end of where we're all ending up at hospitals. And so to Dr. Mohammed and to Michelle D'Emmanuel and to the healthcare workers and to the public at large, Please be very cognizant of that. It's not business as usual at our hospitals. They're under great strain and great pressure and capacity and beyond, and it's taking a toll on our healthcare workers. So please keep them uppermost, because we've been reminded regularly they're getting close to a breaking point, and they can't service us the way we want if we keep adding more and more to their plate. And again, thanks to the folks that keep making that point to us. Dr. Mohammed, a follow-up question for you.
This question is from Steve Cornwell of Metroland. Can you please tell us where the majority of COVID-19 patients that are being transported out of Mississauga and Brampton hospitals are being sent?
So right now, as of last night, we transferred out 20 patients. They're actually going to a number of hospitals. We actually start with our neighboring hospitals first because we have traditionally worked together. So a number of patients have gone to Trillium, Headwaters, Humber, South Lake, and other GTA hospitals. We're trying to work with each individual family and patients to make sure that we don't transfer them too far out, too far away from their local region.
Center established. I believe the application to the federal government was sent out last month. So what, in your opinion, has been the holdup?
Steve, it's a great question. The application has come back and gone back and forth a number of times, but I remain hopeful that we will finally get that agreement signed. And so I believe it's being sent back, or has been sent back to the federal government. So we continue to wait for a response. Certainly recognizing at this point in time that households, in addition to workplaces and social gatherings, continue to be part of that same triad that I've always talked about that is transmitting COVID-19 in this community. It remains a priority, certainly for us, and as I understand it, from our federal partners, and I am hopeful that we will have an answer soon as to when that center will be opening and will be augmenting our existing isolation center. Thanks very much for the question.
Thank you, and thank you again to the media who are on the line. There are still a number of questions. This one is from Marty Marichuk. It is for Dr. Lowe. Marta is from Metroland. Dr. Lowe, in a worst-case scenario, do you see a full lockdown of Peel, similar to what happened in the spring?
So thanks, Marta. I would first say that we didn't have a full lockdown in the region of Peel, similar to the spring, in the spring rather. That was, as you know, something similar to a fairly stringent lockdown where many things were just sort of stay home, but certainly not in the way that was seen with, stay-at-home orders and enforcement of such as was seen in, say, Northern Italy or in China. I certainly have no desire to see something like that in our community, and certainly have no desire to see anything similar to what we saw in the spring, which is why we're making these recommendations now to really try to ensure that we can bring our case counts down again. Again, like I said, I'm all for a balanced approach, but everyone that's pushing the balanced approach and saying you need to think about the things on the reopening side forgets that the other side of the balance is COVID-19. And if COVID-19 is getting out of control, then we need to tip the balance over there to deal with it so that we can get back to the reopening pieces. So all that to say, right now is where we're starting to see things unfold, and I think if we're not careful, it would be certainly a decision that would be made by the Chief Medical Officer of Health in recommendation and consultation with the provincial government ultimately under their new framework. But my measures that I'm putting forward, that I'm asking the community to adhere to, is really about trying to not get there in the first place.
Thank you, Dr. Lowe. If you could remain at the podium. This question is from Snag Dougal at Toronto Star, Queen's Park. Could you speak to whether you think the province's new framework needs to be modified? And if so, would your proposed changes align with the new measures you're implementing for Peel, or would they be something different? And could you please provide some examples of possible changes to the framework?
Sneh, it's a very good question. I mean, I think I continue, obviously, in conversations with Dr. David Williams and our ministry partners, and certainly all of our public health unit partners around the application of the provincial framework. I want to be very clear that us taking these additional measures in Peel were to reflect our specific local community picture. It's a recognition that we are the hardest hit health unit in Ontario, probably one of the hardest hit health units in the entire country. And we do have identified drivers of transmission that we need to address. So a provincial framework is meant to be applied across the province, and for that reason, there will be parts where there's either it is silent or there may be a gap that does not necessarily apply to specific local situations. And so for that reason, at this time, I mean, we'll continue our discussions, but I would say our measures stand on their own and are really about our residents doing the right thing in addition to all the other pieces laid out in the red control part of the provincial framework, to make sure that we're keeping each other safe and keeping our community safe as well.
I have a follow-up, this time for Dr. Mohammed. You've said your hospitals are at capacity. What does this mean right now for non-COVID-19 healthcare like surgeries and procedures? And what could this mean for surgeries in the weeks to come if we continue seeing similar or increased COVID-19 numbers?
So when we're trying to determine which surgeries should be done and shouldn't, we don't base it on whether the person is COVID-19 positive or not. We base it on the fact, will delaying the surgery impact the survival rate or any further complications for this patient? So when it comes to any surgeries that may result in us removing a cancerous lesion or a possible cancerous lesion, those surgeries continue. When surgeries come into the emergency department that require urgent action, those surgeries continue. When somebody's involved in a trauma, if there's a broken bone that needs to be repaired using a surgical technique, delaying that would impact long-term mobility and long-term healing, and those surgeries continue. So that's what we're trying to do. If there's a surgery that somebody may be waiting 6-7 months for because it's what we call an elective surgery or non-urgent surgery, that's what we are trying to delay. As and if the cases continue to increase and our capacity continues to be pressured, then we would look at reducing further non-urgent and elective surgeries, but we would never stop surgeries that need to go ahead based on medical need.
Thank you. And there's one last question, is for Dr. Lowe. It's Nada from the Pointer. If enforcement will be done, is this something that will fall under the responsibility of municipalities?
Sorry, I didn't catch which the outlet was.
That was Nada from the Pointer.
So this is Nita's third question. In respect of enforcement, we will certainly, I certainly believe, as I said, we're focused very much on education at this point in time. But any enforcement, given that this is a letter of instruction under the Emergency Management Civil Protection Act, this would be, enforceable, as I understand it, by any peace officer, given that it falls under the EMCPA. Certainly we can double check with our legal as to my understanding, and we'll get back to you. But again, the focus at this point in time, folks, really, it's about doing the right thing at this point in time. Reduce your interactions. This disease cannot spread if we're not meeting person to person just for the next 2 to 4 weeks. So we don't end up in lockdown. We can keep our schools open and hopefully have a shot at the December holiday season. Thanks very much.
Okay, with that, I want to thank all of our media partners and your patience in bearing with us as we sort of worked out some technical glitches. Certainly, I want to thank Dr. Mohammed and Dr. Lowe. The thought that I would leave you with as the chair and the head of our Board of Health is all the data that I have learned from the science and from our medical practitioners is, dare I say, we're in a crucial week, we're in a crucial 2 weeks. This is the make or break it time. This is the time we realize which way the curve is going. There's an old adage, if I may, in the 32 years that I've been involved in politics and studying it before that years ago. There's an adage that says business people make business decisions, medical people make medical decisions, military people make military decisions, and it's up to the politicians to give you what shade of gray we're looking towards. That's never been less true than now. This is not a time for shades of gray and trying to meld competing interests in terms of what the right thing to do is. What the right thing to do is, what the singular right thing to do is to listen to our medical health community, the professionals, the practitioners, the people in the front lines, driven by data and science and telling us what to do. And I have to commend our team, and especially Dr. Lowe, because I said to him a while ago, and I will repeat it again on behalf of the good residents of the region of Peel, our position and my position is simple. Once I've asked Dr. Lowe to listen to all of the interests that are involved, once we have another 5 o'clock meeting and everybody can express what they're hearing, I asked Dr. Lowe, what is our position? And that is our position, because we must be guided by the science and what is best in terms of the long-term interests of our healthcare community, our practitioners, our frontline workers, and not worried about where we end up today, but worried about where we'll be in 2 weeks, 4 weeks' time, et cetera. So with that, again, thank you very much to Dr. Mohammed. Thank you to Dr. Lowe. Thank you for those of you that have tuned in. Again, with that technical glitch that we've worked through, the press conference is closed. And again, thank you for everyone's participation.